I'm now going to demonstrate why I believe the USB is a better Bougie than the Bougie, as well as a better Stilett than a malleable Stilett when we're using Mac blade laryngoscopes. So just as a Bougie, you can see coming out of the package, the USB has this built-in shape. It has inherent directionality. I know that that's 12 o'clock, 1 o'clock, 2 o'clock, 3 o'clock. I have fine control over which way the distal tip is pointing, which is very important for feeling the tracheal rings. And control of the device is enhanced by the fact that it has a hexagonal shape as opposed to this round cylinder. So inherent directionality, hexagonal shape. There are 2 bits of metal in this device that mechanically amplify tracheal ring detection. There is metal in this gray marked section here, as well as around this curve. By packaging the device with this shape, not only is it convenient to use with the Bougie handoff the way I was just demonstrating a Mac blade, but it also allows for a small footprint. So the USB has a footprint in terms of its packaging and storage that is similar to a tracheal tube, unlike the long Bougie, which is usually hung off of an airway cart or people fold and do all kinds of things with. And by the way, you can't store Bougies circular. Some people do, but the problem is when you do that, what you wind up with is not straight with a distal deflection. You have to then straighten it out to use it. So the USB, its packaging, its directionality, its smaller footprint, its hexagonal shape, its mechanical amplification are all significant benefits over a standard Bougie. So I just want to demonstrate here as we use this. I can scissor with 1 and 3, introduce the blade, uvula points to epiglottis, control the tongue. I can drop my grip down, drop my elbow down, do my manipulation. I'm picking up this USB. I introduce it again. Here we see it below the line of sight to the target. It's got that 5 millimeter outer diameter, half the size of a 7.5 tracheal tube as we approach the target. As I go in, I know which way is up. In other words, under this epiglottis, if I create an epiglottis only view, I know that the Bougie is off to the side. And that's important because you can see it's not going into the larynx. But because of this inherent directionality, even with a true epiglottis only view, I can rotate this around and I can orient the tip in a manner that I know I'm hugging the undersurface of the epiglottis. And now I feel the tracheal rings because of that mechanical amplification. I push it off to here, I pinch it like so. I can take my tracheal tube and run it down the USB. Now, as I start doing this, notice the white part of the USB. Right about here, it's not quite coming out. That's not a problem. As I advance it down, it will come out the top. You don't need to worry about losing the device as you insert it. It's not going to go farther down the trachea. But I rotate it down and I give it that counterclockwise twirl we talked about to the proper depth, take this out and bring it out like so. By the way, the USB has multiple advanced design features, not readily apparent, but the surface of this product has been siliconized to allow for easy insertion and withdrawal inside the tracheal tube. Because it has 6 points of contact, there is actually less friction with the inside of the tracheal tube. And its mechanical amplification, I didn't emphasize where that comes from, but 2 bits of metal no metal here, but what happens is as this tip moves, you can see there's relatively no movement here, there's no movement in this segment, but all the movement occurs between the two bits of metal. And when you hit the tracheal rings, you can see this mechanical bounce start to occur. It starts to vibrate. Nothing in medicine is 100%, but in my experience, over 10 years of development, thousands of cadavers, and now hundreds of true uses where it was really necessary. From a personal experience, I have felt the tracheal rings 99% of the time. And the reason is because I know which way is up, and the mechanical amplification of the distal tip movement created by these two bits of metal.